Hi friends, welcome to classes by Lab Doctor. I am Dr. Divya, and in today's class let us understand a few concepts about creatinine clearance. So you all know that kidney function tests are divided based on the test for assessing the glomerular function, फिर tubular function, urine analysis and test to measure the renal plasma flow. So glomerular function को हमको assess करना है. So what all tests we do? We do the blood urea, blood creatinine, proteinuria, hematuria and the clearance test. And here comes your creatinine clearance test. So basically the clearance is a function of the glomerulus. So अगर glomerulus ठीक से function कर रहा है तो it will be able to do the clearance or clear out certain substances from our blood. So it is the assessment of the glomerular function. Tubular function I have told you, urine concentration test, urine dilution test, tubular proteinuria, amino aciduria, glycosuria, all these are tests for tubular function. Urine analysis, yes, definitely it is a test to indicate a kidney function, and the test to measure the renal plasma flow like para amino hippuric acid test. So let us now concentrate on this creatinine clearance test. So now you all know that serum creatinine, as we have discussed in our previous videos, it may not rise until late stages of this chronic kidney diseases. So patient को आपने टेस्ट किया and उसका creatinine normal आया and you assume that अच्छा patient का तो kidney ठीक है because creatinine तो normally आ रहा है. But until and unless more than 50% of the kidney is damaged, creatinine levels normally आ सकते हैं. So ये एक proper और sensitive guide नहीं हो सकता majority of the time to predict हाँ ये patient को kidney problem है. So and also remember creatinine काफी सारे factors पे depend होता है, age, muscle mass, etc. So these are few of the things which creatinine depends upon. I've told you gender, like in men muscle mass is more, so creatinine levels would be slightly higher. The ethnicity, age, nutrition, diet, drugs, muscle mass, all this will influence the creatinine. Analytical problem, non-specificity, like अगर proteins है, ketones है, ascorbic acid है, pseudochromogens है, they can interfere and give an altered results. If there is a spectral interference with icterus, lipemia, hemolysis, then also you might get a wrong results. And also I've told you that it has a very poor sensitivity for this chronic kidney disease patient. It is not very useful in acute renal failure. अगर muscle wasting disease है, then also the creatinine values will not be proper because creatinine is basically a waste product of muscle metabolism. Why are we doing this creatinine clearance test? So you all know that creatinine is a waste product of creatine, and creatine is a substance which is made by the liver, which is made by the pancreas, and the creatine is the one which is transported via blood to the muscles, and in that process ATP is generated which will help the muscle to contract, and then the byproduct or the waste product is generated, that is creatinine. So the creatinine clearance test will compare the creatinine level in the urine with the creatinine level in the blood. तो ये दोनों को ये टेस्ट कंपेयर करता है. यूरिन में क्रिएटिनिन लेवल कितना है एंड ब्लड में क्रिएटिनिन लेवल कितना है, एंड this will give us an estimate of the glomerular filtration rate. So ये जो glomerular filtration rate है, the rate at which your glomerulus is filtering the plasma is given to us by this creatinine clearance by comparing the values in the urine as well as in the blood. So that will tell us how your kidneys are working, mainly the filtering units. So creatinine is removed or cleared from the body by the kidneys, and if the kidney is not functioning well, the creatinine level rises in the blood because less of the creatinine will be getting excreted in the urine. So this test के लिए you will require blood creatinine, you will require 24-hour urine creatinine. So here it is very important that the sample is collected very thoroughly, otherwise this will give a wrong results. How to collect 24 hours urine, I have already made a video on that, you can refer that. So why do we do the clearance test? Because this is very similar to the glomerular filtration rate. Basically to assess the glomerular filtration rate we do this test. ये clearance का मतलब क्या है? The renal clearance of a substance is that volume of plasma that would have to be filtered by the glomeruli each minute to account for the amount of that substance appearing in the urine each minute. फॉर एग्जाम्पल हम अभी देखेंगे ये है रीनल क्लियरेंस ऑफ सब्सटेंस एक्स. सम एक्स को हम क्रिएटिनिन लेते हैं. सो रीनल क्लियरेंस ऑफ क्रिएटिनिन would be the urine concentration of creatinine, urine flow divided by the plasma concentration of creatinine. So the renal clearance of a substance, we assume the substance is creatinine, is that volume of plasma. How much volume of plasma that would have to be filtered by the glomeruli? कितना volume of plasma glomerulus को filter करना है each minute? Why? To account for the amount of that substance appearing in the urine each minute. So this will compare the concentration of a substance in the urine as well as in the plasma and कितना volume of plasma required है to clear off that substance from the kidney. So that is the meaning of clearance, and because it is the rate we will give it as ml per minute. So I've told you this is a creatinine which comes from the liver through the blood to into the muscle, and in from the muscle the creatinine becomes it is generated and it becomes a waste product and it is removed via the kidney. So this kidney is going to clear the creatinine. Why we prefer creatinine? Because it is filtered by the glomerulus. There is no tubular reabsorption because ये waste product है, हमको reabsorb नहीं करना है. Yes, अराउंड 5 to 10% ये सेक्रीट होता है ट्यूब्यूल्स में. दैट इज वाई हमको ये थोड़ा 10% ओवर एस्टिमेट करता है GFR को, बट दैट वी कैन एडजस्ट. बट वी सिलेक्ट क्रिएटिनिन बिकॉज एक तो एक एंडोजीनस ही प्रोडक्ट है, हमारे बॉडी में ही प्रोड्यूस हो जाता है. किडनी उसको कंप्लीटली फिल्टर करता है. इट इज नॉट रीअब्सॉर्ब्ड बिकॉज इट इज अ वेस्ट प्रोडक्ट. Yes, 10% could be secreted by the tubules and we might estimate GFR, overestimate GFR by 10%. So creatinine is an excretory product which is derived from the creatine phosphate and it is not influenced much by the metabolism or the dietary factors. So it is freely filtered, it is not reabsorbed, and small amount of creatinine is secreted by the tubules. So I've told you it might be overestimating GFR by 10%. So the creatinine clearance is determined by collecting urine over a period of 24-hour period and the sample of blood drawn during the period of urine collection period. So this is a formula how we calculate the creatinine clearance, which we have already told you. U is the urinary creatinine in milligram per deciliter, P is the plasma creatinine in milligram per deciliter, and V is the volume of excreted in ml per minute. So creatinine we use routinely for assessing the clearance because it gives the indication of renal function and approximately it matches the glomerular filtration rate. It is freely filtered, not reabsorbed, neither synthesized nor metabolized by kidney, and it is relatively at a constant rate. However, I've told you that the peritubular capillaries may secrete it around 5 to 10% and the GFR might be overestimated. The GFR is usually calculated by using the formula. Of this here you can see the creatinine clearance is equal to 140 minus age into mass into K divided by creatinine creatinine in the serum. So here this K is constant, that is 1.23 in males and 1.04 in females. Mass is nothing but the kg, the weight, and this is creatinine. Creatinine clearance is almost equal to GFR if and only if the production rate is constant, substance is freely filtered and excreted unchanged in the urine. So I've told you creatinine clearance and eGFR are almost similar. Yes, creatinine clearance overestimates eGFR more than 10%. Both of them are expressed in ml per minute. Creatinine clearance depends upon the muscle mass, the exercise, the protein intake, etc. Whereas eGFR also depends upon the age of the patient, the amount of blood which is coming to the kidney, and the filtering capacity of the kidneys. So the normal results, how do you measure the normal results? So I've told you this is almost similar to eGFR. So the values will be little bit higher than the GFR. So you can take in male around 97 to 137 ml per minute, and in female because the muscle mass is less, it is 88 to 128 ml per minute. But remember, it is almost similar to GFR. So more than 90 is taken as normal. So the normal range of creatinine clearance is 90 to 120 ml per minute, same as the GFR, that is also more than 90 is eGFR is normal. A decreased creatinine clearance is a very sensitive indicator that decreased glomerular filtration rate. So reduced blood flow to the glomerulus also can produce decreased creatinine clearance, and acute or chronic glomerular damage can cause decreased glomerular filtration. So what do you mean by the decreased creatinine clearance? मतलब what are the conditions wherein creatinine clear ही नहीं हो रहा है, creatinine clearance कम है? अगर extremes of age है तो kidney function ठीक से नहीं होगा, kidney problem है, damage to the kidney है, tubular damage है, kidney failure हो गया है, किडनी में ब्लड फ्लो ही कम हो रहा है, हार्ट फेलियर है, सपोज इफ देयर इज डैमेज टू द ग्लोमेरुलस, ग्लोमेरुलोनेफ्राइटिस है, दैट टाइम आल्सो द creatinine clearance will go down. If there is loss of body fluids, if there is dehydration, the amount of blood flow itself to the kidney will be less. Bladder outlet obstruction, heart failure, all these conditions will reduce the creatinine clearance and the level of creatinine in the blood will rise. When do we get increased creatinine clearance? Suppose if the patient is taking increased protein intake, in cases of pregnancy, if the patient is doing heavy exercise, strenuous exercise, in case of high cardiac output like pregnancy, etc., we might get increased creatinine clearance. So that is all about creatinine clearance. Remember, creatinine clearance will help us to assess the glomerular function, the filtering capacity of the glomerulus. It is very much similar to the eGFR. It also depends upon various factors like age, the muscle mass, etc. Yes, it overestimates eGFR by 5 to 10%, but that factors can be corrected. But because it is endogenously produced, it is cleared completely by the kidney, neither reabsorbed by the kidney, it becomes a very useful parameter to assess the GFR of the patient. So that is about the creatinine clearance test. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.